Hi, I am Andrea Wang Sam, a proud volunteer for and supporter of the American Heart Association. As a heart attack survivor myself, I am so excited to sit down with you and talk about the critical importance of women's cardiovascular health. The Red Chair Series conversations seek to inspire and inform women to be strong advocates for their health and well-being. Let's get started. Dr. Hanghang Wang is a cardiothoracic surgeon with Johns Hopkins Medicine. Welcome, Dr. Wang. I am excited to talk to you about the innovations in cardiac surgery and the use of new tools like artificial intelligence, also known as AI. My first question is about how you're seeing AI in your practice and how you're using it in diagnosing cardiac diseases.
Sure, Andrea. AI really has changed how we diagnose and treat diseases. For example, during the COVID pandemic, AI has helped people diagnose COVID using algorithms to analyze CAT scans, and within 20 seconds, you are able to tell if the patient has COVID pneumonia or not. And this has really been utilized in many aspects of my practice as well. For example, we're using AI to help predict which patients are going to go on and have aortic dissections if they have aortic aneurysms. We're using AI to help us analyze how we are efficiently utilizing the operating room, and we're using AI to track how we're treating patients better.
We hear about AI being used in call centers and other places, but what about surgery?
Yes, there are a lot of places where AI can be used in surgery, starting at first from when we determine whether to perform surgery on patients. For example, when patients show up in our clinic, oftentimes they do not know what exactly is involved for their surgery, and there is a gap in health literacy between the doctor and the patient. I'm sure you've had some of that experience as well. Sometimes patients just don't understand what exactly the doctor is talking about because of the gap in knowledge and gap in health literacy. AI can mitigate that. Using natural language processing, AI can help doctors understand where patients are coming from and help patients understand the complex medical knowledge and the complex medical terms, and breaking them down into pieces where they can digest. After that, AI can help us in planning surgery as well. For example, analyzing complex images of patients, such as echocardiograms and MRIs, to help doctors come up with a comprehensive operative plan. Lastly, AI can help train doctors in the operating room. We are developing AI algorithms that can analyze how doctors operate and their surgical skills, and help doctors become safer and more proficient.
Do you see AI being used to treat women differently?
Yes, I do. I think AI offers a great opportunity for women to get diagnosed and treated much earlier than right now, because historically, most research in cardiovascular medicine were conducted on men, and women were left out in a lot of clinical trials and research. Therefore, we know very little about the specifics of women and how we treat them. I think AI can be a tool to both help women identify diseases when they are at an earlier stage and help doctors make informed decisions about treating them at an earlier stage. I recently had a very interesting conversation with an AI expert at Hopkins. His mother unfortunately had a heart attack, and his father had a heart attack as well. But his mother was diagnosed much later when she presented, because the doctors didn't think that she was suffering from a heart attack. So he wants to collaborate with me specifically on finding predictive models for women in diagnosing heart attacks much sooner than now.
Dr. Wang, this has been a truly fascinating discussion. Thank you so much for sharing with us. The American Heart Association has many articles on emerging research around artificial intelligence, along with resources online at www.goredforwomen.org. Thank you, Dr. Wang, and thank you to Johns Hopkins Medicine for supporting this campaign.
Thank you.